Hey, welcome back, everybody. Of course, you know me. My name is Dr. Keith McNally. I am here with Jody Holeton, who's now by Zoom's account, Jody's iPhone. And of course, this is Trail to Transformation, the podcast where we talk about veterans helping veterans. Today, we're here with Diane Wyzga, who is a veteran herself. Isn't that right, Diane?
It is indeed, Keith. Yes. Thank you for inviting me, and hello to you too, Jody, and your iPhone.
And so you served as a naval officer, if my memory serves, yes?
Yes, I was the Navy nurse stationed at Portsmouth Naval Hospital, and I worked exclusively pediatrics, which for your listening audience means little people all the way up to I think we took care of kids up to about the age of 16 or so in a big open bed ward.
Wow. And so that's here in my local area. So I'm here in Eastern Virginia.
Mhm.
So Portsmouth is a neighbor of mine, of course, Norfolk Navy Base,
Mhm.
and all those cool areas here. And so let's go ahead and dive into this conversation. You saw some unique stuff while you were a nurse. Yes?
Yes, I did.
Families do face challenges. So families in the military and veteran families as well face challenges. Can you talk about some of the challenges that families face, especially when one of the adult members is serving?
Well, think about it. Let's start at the overarching challenge, which is that anytime you have a child in the hospital, that's huge, civilian or military. And the the ward was actually unusual compared to a civilian ones, meaning that we had a 30-bed open ward, and so it looked like something out of the old military movies. Beds on either side, all the way down. There was a 4-bed or a 4-crib hydrocephalic unit that we used for kids that were born and with hydrocephalus, water in the brain, and then coming back for treatments later. There was also a 2-crib burn unit. So it was a lot. There was a lot there, and that was just surgical pediatrics. Medical pediatrics, which I worked in later, was over in the old building. So imagine that you're a parent and you've got a child, regardless of the age, and going into the hospital for something, whether it's a medical issue or whether it's a surgical issue. And so already there's a challenge there. How am I going to manage that? How am I going to pay for that? Who's going to take care of my kid? And it's doubled, I think, when you're in the military, because oftentimes a spouse, when the spouse is deployed, whether it's whichever spouse it is, when the spouse is deployed, you're there making decisions about what to do and how to handle it alone. And that is huge. And it really speaks to the strength and it speaks to the strength and resilience of military spouses. I can give you an example if you want.
Please, please.
So I remember so I worked a lot on the night shift. So that'd be 2300 until 0700. And that was 10 days on, 4 days off. And I remember a woman, young woman, bringing in this gorgeous, gorgeous, gorgeous blonde haired toddler with a huge belly. And the surgeon that was on call that night made the diagnosis that the child had a Wilms tumor. Not good, not good at all, often fatal back then, anyway. And so here was this woman whose husband was an officer on a ship and had been deployed, trying to make decisions about what to do for this child because surgery was what had to be done. And sitting at the bedside with her while she's making these decisions, while she's going through the what ifs, holding the hand of it's a little kid. I mean, it's just a little kid. And so you really get to appreciate what the Navy family is all about, because everyone there is Navy and everyone there is holding up the roof as it were, or the net, so that she can make the best decisions that she can on behalf of her child and on behalf of her and then her spouse. And then the other thing that I remember very clearly is the grade of doctors, of pediatric doctors I worked with. I mean, these men and women came from some of the finest hospitals in the country, and their job was to take care of children. And I remember, because there's two things I want to tell you. So I remember one, he was a urinary specialist, Dr. Underhill, and the laundry department probably hated him because anytime one of his children needed to go or one of his patients needed to go into surgery, we did a lot of kidney urinary tract surgeries, often to correct problems. He would draw with his ballpoint pen on the sheet so he could explain to the parent what they what they were looking at inside and what it was that he had to do. But he endeared himself to the parents by doing that, and he had the kids call him Dr. Under the Hill. So, it's things like that, and maybe they go on in civilian hospitals, and I'm sure that they do, but these are the memories that stay with me because this was my first foray into nursing. I graduated with a BSN, and within a couple of months, I showed up at Newport, Rhode Island, to the Naval Training School up there, where we learned how to march in January in pantyhose and high heels in the
Important.
snow.
Mhm.
That's right. It was Newport.
It's
Exactly.
very, very important.
It was it was hugely important. So this was my first introduction to nursing. And the other thing that is the core staff. So the men and women who served as corpsmen, the core staff, they were training me as well as the other LPNs that were there. I could go on all night or all morning.
Well,
What else?
well,
Sorry.
the challenge is that, you mentioned that this lady had to make a decision minus her spouse
Yeah.
about how to take what's the best care for the daughter, right? And so over the years that you served as a naval officer in pediatrics, those kind of things are rather typical. Adults have to make real critical decisions, pivotal
Yes.
decisions, possibly, to make the best decision for their child. And so without the accompanying, their spouse or their partner, or that can be a really, really difficult situation to be in.
It's enormously difficult when you think about when you, when you think about what you're taking on. Am I making the right decision? Am I doing the right thing? And then you have to leave your child. You don't get to stay there overnight. You have to walk away and trust that whoever is left behind taking care of your child has the same level of care, compassion, understanding that you do.
Yeah.
I mean, and see, that's the other thing too. I remember, I remember being outside the ward, and there was a little girl, maybe 7, who wanted to call her mother before she went to bed. And she went to a bank of phone booths out in the hallway, and she called her mother to let her know that she was okay. She was going to go to surgery the next morning, but she was okay and she was going to go to bed. And her mother must have asked her a question because she turned to me and she said, "What time do we close?" And I said, "We don't. We're here all night." And she turned her back to her mother and she said, "Don't worry, Mom. They're here all night." And that right there, it's just when you're a nurse, you're always a nurse. But that right there says something to me about, nursing and pediatrics and being able to comfort a parent who is away. And and it is those aspects of pediatric nursing in the military that I treasure that have stayed with me all these years.
Well, Jody?
I've got to ask you. So I've been in and out military hospitals and civilian hospitals. How do you find you being a Navy sailor? How does that support your medical skills? Like when you do that, because I like when military people serve me because I know they have Army values.
I mean, is there a different code of ethics when you're in a military hospital versus a civilian?
I've seen it. I see military hospitals like Eisenhower, like at Fort Eisenhower now,
Yeah.
Eisenhower Army Medical. They are usually more on point, like Army nurses and Navy nurses
Oh,
care
yeah.
more. Yeah.
Absolutely, Jody. I would agree with you. But think about it. We're underneath the military umbrella. So whether it's Army or Navy, you're under a military umbrella. And whichever branch of service umbrella you're under, each of us has that code of ethics. So to be Navy says something to me that is different than if you're a civilian nurse walking into what are all owned hospitals now and you're responsible to shareholders. It's a completely different mindset. When I drove on to the base, I'm there in my uniform and I'm walking into a Navy hospital as a Navy nurse. It makes a whole lot of difference to me. And I'm held in my mind, and because Captain Brennan made us do this, to this code of ethics and this way of caring that embedded in me a a what a behavior that stayed with me all my life through other nursing and to today. So to answer your question, yes, I do find that it's different, and I find that part of it is because of the ethics of the military branch that you're serving in. But also think about it, all the things that we're responding to, the plan of the day and the way you do it and the language. I mean, a ladder is a ladder and a boat is a boat and a ship is a ship and a head is a head. Every branch has its own language. And so it's almost like you're in, without being discriminatory, it's like you're in an exclusive club. And that to me was really important, to be a Navy nurse. And that's what I say. I was a Navy nurse first. I was an officer, yes, but I was a Navy nurse first.
I think one of the values there is that there's this camaraderie. So regardless of branch of
Yes.
service, you're going to support, your comrades in arms
Yeah.
per se. And I remember one time, as a Fleet Marine, in Camp Lejeune, I actually had surgery, minor surgery, but it was surgery on my leg. Um, and I was in the hospital, and literally felt like I was in prison because I had no out. My family at the time, so I was up in Pennsylvania, and so I'm really kind of by myself, and the only people that were there, the nurses and the doctors, not even, my colleagues in my platoon, because they're all, they're taking care of business. Being the infantry, you go out there and train, you're out
Mhm.
in the field. And so
Mhm.
I was on sick leave for a couple of days. Basically, I was just in the hospital as I was recovering.
Mhm.
Um, and so having those people there who can recognize, such as yourself, recognize the value of, we're comrades, we're here to take care of you.
Mhm.
We're here to just help you get back on your feet and get back to
Mhm.
work. But
Mhm.
knowing that there's somebody there because your family can't be is so, so critical and so
Mhm.
important as a service member.
Yeah, no, that's a great point because we took care of a lot of kids that came up from Camp Lejeune because Portsmouth Naval Hospital was the primary pediatric facility, at least for surgery,
Yeah.
on the East Coast. And so we had other members of other branches there. And I think there is that sense of protection, of support, of we're on this together. And so if I use the words, it's like in a club, maybe not the best use of term, but in effect, it is because we have a language, we have a way of behavior, and we have a way of supporting each other because we know what it's like. Oh,
Jody,
Jody's
what
got a
you got?
question.
And empathy, right? Because
Yeah.
we can walk, you, you may be wearing high heels, but you walked in our boots and we walked in yours, and we're going through with our family and our kids.
Yeah.
Uh, how did so you with all your experience? I would really like to hear what advice you have for family, um, for military family members right now.
How so, Jody? Could you be a little bit more specific about the type of advice?
So we have all these families who get hurt or injured in American military, right? Is there something they should do to help prepare them for better health? Like something specific, of like keeping a track sheet of like their when they see a doctor, keeping a medical journal,
Oh, I
something
see where
like that.
you're going. Okay, I would say the same thing that I would for someone in the civilian world. Whenever you go to the doctor, to the ER, bringing a child, bringing someone else there, have with you written out on a piece of paper, keep that in your wallet all the time, the list of any kind of medication someone's on, or different procedures that they've had, or when you're going in for a complaint, try to have written down ahead of time, what's the complaint? What are the signs and symptoms of what's been going on? When did it start? What kind of pain is it? So that when you're sitting in front of the healthcare practitioner, the doctor, the nurse, the PA, you can be much more specific about what it is that you're there for. And the other thing that I would say, be your own best advocate, because even though we're talking about the camaraderie and the support and the cohesiveness of military services, I think it's still important that you're your own best advocate when it comes to healthcare. So take advantage of doing some research of what's on Google. Don't go crazy, about what it is that you think you might have or not, but seek a second opinion if that's available to you. Ask questions. Always, always, always ask questions, even if it means confronting authority. Ask. Ask about what's going on, what's going to happen, when's it going to happen, how is it going to happen, what will be the outcome of it. Is that getting closer to the answer that you're seeking?
Yeah.
Okay.
So,
Right.
so being prepared is always a good strategy to have,
Yep.
and definitely, in terms of medications, previous procedures, and your current condition. But I kind of
Mhm.
want to switch the conversation real quick because sometimes service members and veterans are challenged not by the situation that they're in, but finding the resources to kind of help them get through the situation they're in. And so, from a medical perspective, Diane, have you seen that? Do you see that there are challenges about finding the resources? Because we don't know what we don't know. And I know that's an old cliche, but if it wasn't for Jody here, I wouldn't have known some of the available benefits as a veteran. So I'm kind of wondering from your perspective, Diane, are you familiar with, how to access certain things that are rightfully the benefit of veterans?
Well, what I will say is that where I started out, so when I transitioned, so think about this. We all start as civilians, and then we go from civilians into the military and military back to civilians again. And so we know an awful lot because of what we brought into the military and what we gained while we were there. So we're not stupid people. We're curious people. We're inquisitive people. We know how to research. We know how to problem solve. We know how to strategize. So I think we start with that. I know how to do something. This is important. I graduated with a 4-year degree, a BSN, and we had a lot of theory and not as much clinical time on the floors as our colleagues who were 3-year RN nurses. But what I was taught is what you've gained is the ability to know where to go to research, to inquire, to look, and to learn. And with that ability, you will catch up with the clinical skills. Don't worry about it. And so when I transitioned out, I was lucky because I knew about the GI Bill, and that's what allowed me to go on to UVA. There's some resources which I hope we'll put in the episode notes, but the VA generally has links to just about everything that you would possibly want in terms of crisis lines, healthcare, benefits, career and mortgage and insurance and rehab and burial and memorial services. There is a plethora of information out there on the VA website. There are local resources that you can go to. I know here on the island of Whidbey, because we have the Oak Harbor Naval Air Station, there are resources there. It's just a matter of inquiring. And if you aren't near a military station, then finding out what's in your area location that is civilian that you're entitled to. And I will tell you that I've been learning over the years from a corpsman I worked with who is now in Colorado and who has some disabilities about what is available. And he's a character, that one. He won't take no for an answer. And I think that's part of what he's figuring out. I went to the VA. He's got problems with vision. He's considered legally blind, but he was able to find out how to get to a facility in Arizona and learn how to use different tools, get assets and resources like different computers and things that speak to you, because he kept looking and saying, but this is what I need. This is what I need. This is what I need. He wouldn't take no for an answer. And it was just a matter of looking. And I will tell you one thing that he's done. He needed a seeing eye dog, and he didn't want to go through the normal channels just because it was a lot of red tape. So he figured out how to get himself a dog from the pound who was really trainable. And this dog is wonderful. And he kept going back to the VA and saying, this is what I want. This is what I want. This is what I need. This is what I've got. So how do you help me buy food and whatnot for this dog who I'm training to be a seeing eye dog and is really, really good? So it's that. It's starting with, I'd say, with the VA link, and then looking at where that takes you and what other resources are available in your community. Is
One
that
of
what you're looking for?
That's exactly perfect. And the only other
Yeah.
aspect I want to add, and hopefully Jody could add to this part of the conversation as well, is building a tribe, building that community of
Yeah.
people that on social media we call it know, like, trust. But for veterans, it's very, very important. I'm double emphasizing very. It's so important for veterans to find those people, build that tribe, that community around them, so that they don't get lost in the bureaucracy and the red tape and anything that's going to prevent them from accessing either resources or help or something that they need. Because that's typically what happens, is that even though, the va.gov website is, as you say, has a plethora of, hyperlinks to go to, and there's a manual and there's a PDF version of that manual that says, this is what we got. They don't necessarily advertise it. They're not
Yeah.
the VA isn't necessarily saying, hey, vet, this
Got to come and get
here's
it.
everything on the table here.
Yeah.
No, you have to go find it. Like you said, you have to go
Yeah.
find it,
Yeah.
advocate for yourself, Jody.
And fight for it.
Yes.
So I just did a CAP exam for PTSD and my physical disability things. And I tell you, I got manhandled. I got sent to it's supposed to be an X-ray appointment yesterday, but it was really a blood appointment. I've been using Google, AI, and calling my VSO, the Legion, the VFW, and my friends, going after these benefits, not just for myself, but for our community, for this podcast. It is a fight. There's so much out there.
Yeah.
I think that's the ticket to it. There's a lot there. And I will say that I'm a member of the Navy nurses in the Pacific Northwest, and there's a national organization. And while I don't necessarily keep in touch with all of them all the time, it's nice to know that they're there. They know me and I know them. And when it comes to fighting, Jody, so my friend has other issues, and he needs services in civilian hospitals if he can't necessarily get to a military facility. And he had, just as you've said, a bit of an issue, a big bit of an issue following a procedure. And he took the hospital to task. He wrote a letter to them and said, this is what happened. This is what was supposed to happen. This is what didn't happen. And I want something done about that. And he listed what he wanted done. I mean, he wanted a lot of people pulled on the carpet. But he actually followed up with that and he got a response, but he wasn't satisfied with this response. And he decided to escalate his letter to the State Hospital Association and register a complaint. And so just like we've had to fight in any situation in our lives over the course of our lives, this is no different. But the good thing is we have the ability to do that. And that's what we count on.
And I don't think there's any better way to end this conversation than with those words right there. Advocate, fight, and get what you need. Yes.
Right? Because then you win.
And then you win. Diane, thank you so much for joining Jody and I on Trail to Transformation. And for those of you who've been watching or listening, we'll see you next time. Take care.
My pleasure.